how does the implementation process at this practice compare to some of the ones you've seen in the past?
This implementation was pretty typical of what we see. The problems they're facing now that Sue spoke of earlier are what we generally see. Because the system is a generic system and it's not configured exactly to the practice's workflow. So things during the first week of go live, during training week, and for a couple months, you're going to be tweaking the system. You're going to be adding your favorites. You're going to be changing some of the words so they're more searchable for the product. For the providers, changing some of the ICD-9 search words so they can actually get them, or teaching them to do it because they know how they speak and a different provider might be doing that. And again, it's really working with them to be more self-sufficient, to learn the system where they can easily make the edits rather than Sue or Valerie make the edits. And that's a comfort level, and that comes at a different phase with each provider. But again, if they're changing the search functions of the ICD-9 categories, they need to know what they're going to be looking for. It's typically not Sue. But generally, practices come together and things are edited for that. They had some issues in the beginning with the training process. We subcontract out to eClinicalWorks to do the project management portion, and we've been struggling a lot with the training. Initially, we had not consistent trainers that didn't know pediatric practices, so we eventually put where we have 2 specific trainers, and that started about a month and a half ago, where there's 2 trainers that train all our pediatric practices, so they know pediatrics, they get to know CIQN more, and we can work with them on problems that we've had. And as we were talking before with Sue and some of the problems they had with training, specifically a large group, not a lot of space, different styles of trainers. And one of the things we discussed is we need to do, during that 12-week implementation call, a schedule halfway through a call where we're going to talk about training, saying this is how it works, how can we work better, how do we need to schedule your staff so everybody gets training, is there a room that we can do it where we can divide half the staff, or are we going to have to train everyone at once? If we're going to have to train everyone at once, can we do that towards more of the evening hours, or would it be better for this practice to do more of the morning hours? Because every practice works differently, but the training is a really important component, and it lasts a week, and you have an access to a very experienced user for 1 week.
So
and
it sounds like training is one sort of pre-implementation issue that people should really focus on. What are some other takeaways based on your experience of seeing these implementations that people should be thinking about and planning well before they go into the go live week or period?
Well, when we first work, when you go into the go live week of period, you need to do things like what they found out is also you need to check your computer connections. You need to check each computer. You need to check everything, because you don't want to spend that time when you're training trying to fix things. So you need to make sure everything's working. You need to make sure that everybody's on board. We have a pre-assessment tool that we generally use with practices, that who's on board, who's going to be the champion of this. And it was easy with this practice because they have a lot of really good champions. But some practices there's no leader defined, so you have to make sure you have a leader, both a physician leader and administrative leader, be that a medical assistant, be it, and it again depends on the size of your practice. But in some of the smaller 1 and 2 FTE practices, generally it's the physician, but he or she still has to have a team leader on the medical administration or the administration side that's really going to push that change and keep everybody going as they move through.
Great.
Also, your IT portion is very important. We generally contact with a company called A&T Systems that they're trained on the eClinical, which is the software that we use and the system that we use, so they know typically what a smooth go live goes like, and they've also seen some go lives that have been disasters, so they have a lot of experience on knowing how to deal with it, and choosing a good IT vendor is also something you need to think of.